Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Peter Parker. For questions 1 to 12, complete the notes with a word or a short phrase. You now have 30 seconds to look at the notes.
Come on in, Peter. I've asked your tutor to wait outside for a bit, so that the two of us can have a real chat about what's happened. I hope that's okay.
That's fine. Mr. Engelman's just being a worrywart. I already told him that I'm fine. I just hurt myself is all. Look.
Oh, wow. Peter, that's a nasty bruise. How did you manage that?
It's more than a bruise, nurse. I had an x-ray earlier, and the doctor said that my arm is broken.
Oh, dear. How did you manage that?
Have you ever seen any of the Spider Guy movies?
Sure.
Well, in the second one, about halfway through, there's this one scene where he hangs off of the Empire State Building when he's being chased by Lido. Well, I share a room with my little brothers, Prentice and Polly. Prentice was Lido. Polly was a cop, and I was Spider Guy. Anyway, at around 7 a.m. this morning, I jumped onto my bunk bed trying to swing off of it into Prentice and Polly's, but missed, fell down, and landed badly on my side.
Oh, no.
That's not the worst part, nurse. I have a real stinging pain on my left elbow, and it's not just this bruise. My thigh's got a nasty one on the same side as well.
Well, I guess you and your brothers won't be playing that game again.
No, sir. It wasn't even my idea in the first place. But I've learned my lesson.
I hope so. So, Dr. Gessens asked me to check the fit on your cast and to make sure that you get a cold compress, too.
Is that like an ice pack?
Yes, it is. It'll slowly get warmer when it adjusts to room temperature, but if you find that that happens and you're still feeling the pain, then you can still get the same sensation by using a frozen bag of peas or something similar from the freezer at home.
Okay. Thank you.
You're welcome. I mean, I can see on your notes that Dr. Gessens already prescribed you with painkillers. Is there anything else I can help you with today, Peter?
Nah. Unless you know how to make time go faster. I really want to be better. My mom won't let me ride on my bike or skate, and it's such a drag. Why do parents have to be so strict all the time? I know that what I did wasn't the smartest thing I've ever done, but this is a little harsh, don't you think?
I don't think your mom's trying to punish you. I mean, what did Dr. Gessens say?
He said the same thing, pretty much.
I think they're both just worried that the increased physical activity might make your injuries worse. It's good advice, Peter. I would lay off the extracurriculars and concentrate on getting better. When you're feeling better, do me a favor and call in and ask Dr. Gessen for his say-so and further advice.
I will. Nurse, can I get a sling? Then everyone will know that I'm hurt, and it will look way cooler that way.
It's a good idea to rest it, so I'll see what I can do.
Thanks.
You're welcome. I'll ask for you to get an appointment to come back to see Dr. Gessen in 4 weeks' time for another x-ray to make sure that everything's healing nicely. It'd also give you a chance to get a new compress if you still need one.
Part A. You hear a specialist physician talking to a patient called Julie Dooley. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Your GP says you've been to see him about a lump in your breast. So, when did you first notice this lump?
10 days ago. I was doing my routine check when I was just so shocked to find it. It's in my left breast. I'm really worried because my mum died 6 months ago from breast cancer, and I've been scared of getting it ever since.
How old was your mum?
65.
Do you know if anyone else in your family has had it?
I don't believe anyone else has. I don't remember.
Mum,
65.
do you know if anyone else in your family has had it?
I don't believe anyone else has. I don't remember either of my parents talking about it affecting their own mums.
Are you married?
Yes, but we separated 9 months ago. He went off with another woman, and I'm on my own looking after my 2 children. I've got a girl who's 14 and a 12-year-old boy as well.
Have you ever been sick with anything serious before?
No, my health's always been very good.
I take it you're not on any medication then?
That's right, nothing. But there is something else that's been playing on my mind since I noticed the lump. I started remembering this pain I've been getting just here, in my chest. I never really thought anything of it before because it was kind of, oh, I don't know, just very dull, like I'd pulled something, a muscle of some sort. So I really wasn't very worried about it. I just thought it would go away in time. But now, I don't know. Do you think it could be a sign of something?
That's difficult for me to say until I examine you and we run some tests. Is there anything else you can tell me?
About the pain? Well, it seems to go to my back. I usually only notice it when I'm sitting in a chair. Not a chair at the kitchen table. More like when I'm sitting in the lounge. You know, something with a high back on it. It did wake me from sleep once. It only lasted for about 15 to 20 minutes, but it was probably the worst I'd felt it. There hasn't been anything else really. Like I said before, I'm usually pretty healthy.
You haven't had any nausea or vomiting with it? No shortness of breath?
Nothing else except for what I mentioned. Oh, I do hope everything is all right.
Of course. Do you mind if I examine you now so I have an idea what we're dealing with?
No, that's fine.
Okay, there it is. Does that hurt?
No. Oh.
Right, it's quite solid, roughly 2 or 3 centimetres in length, I'd suggest. We'll need to run some tests to confirm exactly what it is. We can do those today, now actually, and then wait a few days for the results to come in. I'll need you to make a follow-up appointment on your way out today.
Okay, that sounds fine. I know I'm probably getting ahead of myself here, but if it is cancer, I really don't want to lose the breast. I'd hate to have a mastectomy. I dread that probably more than anything else. I really don't care what else happens, so long as I don't lose the breast. My mother had chemotherapy after she was diagnosed with cancer, and even though she lost all her hair, at least it grew back. I'd still be willing to try it.
Okay, well, you are jumping in a bit early here, but there may be options. First, let's run the test and wait for the results.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a nurse talking to a patient who's about to have a mammogram. Now read the question.
So, have you had a mammogram before?
No, I haven't, and I do have a few questions actually.
Mm-hmm.
Like, what about the radiation? Do I need to worry about the dose? Is it likely to be harmful in any way?
No, it's very low. In fact, it's similar to the amount you'd receive if you took a long-haul flight.
Oh, yes, that reminds me. When will I hear? 'Cause I'm away in New Zealand for a month from next Wednesday, and I'd like to know as soon as possible.
It'll take about 2 weeks, but if you're concerned, we can give you a number to call.
Oh, thanks. That'll be a real help, actually. Um, then for me, the big question is it going to hurt? I've been hearing gruesome stories from friends, and my anxiety levels are going through the roof.
Okay, I understand. Perhaps you could tell me exactly what you...
Question 26. You hear a doctor talking to a patient about a blood pressure monitor. Now read the question.
It's like a normal blood pressure monitor, but it's mobile. You wear it on a belt around your waist and it's attached to a cuff on your arm. Then you just go about your usual day-to-day activities and it takes your blood pressure at regular intervals. It's more accurate because we can avoid what's called white coat syndrome. It beeps first, usually every 30 minutes or so. When that happens, you should sit down if you can, hold your arms still, and keep the cuff level with your heart.
Do I have to wear it at night?
Yes, you do. You could put it under your pillow. It needs to stay on for 24 hours, though you don't have to wear the belt.
What about showering and stuff?
Well, I was about to say, you should avoid that, I'm afraid.
I see.
Question 27. You hear a dentist and her assistant talking about a problem with some sterilizing equipment. Now read the question.
Oh no. It looks like the autoclave is playing up again. The temperature's only 117. That's 4 degrees lower than I set it for.
Yeah, I noticed that. Yesterday it was at 119 and I just couldn't get it to go any higher. Shall I have a look in the instruction manual and see if I can sort it out?
Well, that might invalidate the warranty. Could you find out whether the one next door's working properly? I expect it's because the hard water around here has caused a build-up of scale and that's affected its efficiency. Perhaps you could ask reception to get the company to come out as soon as possible. If they can't come tomorrow, we'll have to wait until Wednesday and make sure everyone knows it's out of order. If you could send a quick group email, that'd be great. That's the second time this has happened, and it's still under guarantee.
Question 28. You hear a GP talking to a patient with hay fever. Now read the question.
How can I help you today?
I need something to help me manage my hay fever this summer. It's already become unbearable. I don't want to have to stay indoors when all my mates are out enjoying the good weather. We're all off camping next weekend, and I'd hate to miss out on that.
What's bothering you in particular? Perhaps I can give you something to make you more comfortable.
Well, I keep getting this horrible headache thing. It's like at the top of my nose, and it's really getting me down, to be honest. Then there are the watery eyes. I mean, I can feel them puffing up as soon as I leave the house. They're so itchy, red and painful and look awful. I've got a summer job working at music festivals, so there's no escaping. I'm literally in fields all day, every day. Is there something you can give me?
Question 29. You hear two nurses doing a patient handover at the change of shift. Now read the question.
So, in bed 6 we have 83-year-old Mr. Beard.
Okay.
He was admitted this morning and he's been diagnosed with bacterial pneumonia of the right lung. He's quite poorly at the moment, but stable. He's lactose intolerant, so can you talk to the kitchen and organise something suitable for him?
Okay.
Otherwise, he has no known allergies. He's been for a chest x-ray, but we're still waiting for the results to come through. We may need to do a CT scan too, but we'll have to wait to see what the x-ray results reveal before we can arrange that.
Right.
His SATs were at 57, so he's on 2 litres via a nasal cannula, and that's to be reviewed after 2 days, so not until tomorrow morning. Oh, and I forgot to mention, he had a fever of 39.4, so he's also on antibiotics via IV, which he's not very happy about.
Question 30. You hear a hospital manager briefing newly recruited staff about patient safety. Now read the question.
Within the information team, we provide a set of standard and custom-made reports to suit the needs of staff and patients. Our aim is to provide information into the patient's journey, from their arrival in the emergency department to their discharge from outpatients. One of my responsibilities is to ensure that the information we provide is clear, easy to understand, and straightforward to use, so that we can look at areas of concern, things that are common across departments, and reassure ourselves that we are delivering quality care. When things go wrong, we're able to provide information from the system to enable the staff responsible to review the situation, understand, and learn what needs to be changed to avoid future events.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, for questions 31 to 36.
Kaposi sarcoma is a type of cancer that forms from the cells that line blood vessels or lymph. It usually looks like tumors on the skin or on mucosal surfaces, such as inside the mouth. However, Kaposi sarcoma tumors can also develop in other parts, such as in the lymph nodes, digestive tract, or the lungs. The abnormal cells of Kaposi sarcoma form red, purple, or brown tumors or blotches on the skin. These affected areas are known as lesions. Often the skin lesions of Kaposi sarcoma appear on the face or legs. However, usually they cause no symptoms. Certain lesions on the groin area or legs may cause a painful swelling on the legs and feet. Kaposi sarcoma can cause severe problems or even become life-threatening when the lesions are in the digestive tract, liver, or lungs. For instance, Kaposi sarcoma can cause bleeding, while tumors in the lungs may cause trouble breathing. The different types of Kaposi sarcoma are defined by the different populations it develops in. However, the changes within the Kaposi sarcoma cells are very similar. Epidemic Kaposi sarcoma or AIDS-related Kaposi sarcoma. The most common type of Kaposi sarcoma in the US is epidemic or AIDS-related Kaposi sarcoma. This type of Kaposi sarcoma develops in people who are infected with HIV. However, a HIV-infected person does not necessarily have AIDS. The virus may be present in the body for a long time, often many years before causing any illness. The disease called AIDS outbreaks when the virus completely damages the immune system, resulting in certain types of infections or other medical complications, including Kaposi sarcoma. When HIV damages the immune system, patients infected with a certain virus are more likely to develop Kaposi sarcoma. Kaposi sarcoma is considered an AIDS-defining illness. That is when Kaposi sarcoma occurs in the patients infected with HIV. That patient officially has AIDS. In the US, treating HIV infection with highly active antiretroviral therapy has resulted in fewer cases of epidemic Kaposi sarcoma. Yet, certain patients develop symptoms of Kaposi sarcoma in the first few months of highly active antiretroviral therapy. For HIV patients, highly active antiretroviral therapy can often progress the Kaposi sarcoma development. However, Kaposi sarcoma can occur in people whose HIV is well under control with highly active antiretroviral therapy. Once Kaposi sarcoma develops, it is still essential to continue highly active antiretroviral therapy. In the regions where highly active antiretroviral therapy is not accessible, Kaposi sarcoma in AIDS patients can advance quickly. Classic or Mediterranean Kaposi sarcoma occurs mainly in older people of Mediterranean, Middle Eastern, and Eastern European heritage. Classic Kaposi sarcoma is more common in men than in women. Patients have one or more lesions on their ankles, legs, or the soles of the feet. Compared to other types of Kaposi sarcoma, the lesions in classic Kaposi sarcoma do not grow quickly, and new lesions do not form as often. The immune system of patients with classic Kaposi sarcoma is not as weak as it is in those who have epidemic Kaposi sarcoma, but it may become weaker than normal. When this occurs, people who already have a Kaposi sarcoma-associated herpes virus infection are more likely to develop Kaposi sarcoma, endemic Kaposi sarcoma, or African Kaposi sarcoma. Endemic Kaposi sarcoma occurs in people in equatorial Africa. Kaposi sarcoma-associated herpes virus infection is very common in Africa, therefore the risk of Kaposi sarcoma very high. Probably there are other factors in this region that weaken the immune system, such as malnutrition, malaria, and other chronic infections, which may also contribute to the development of Kaposi sarcoma. Endemic Kaposi sarcoma occurs in younger people under 40. Rarely, an aggressive form of endemic Kaposi sarcoma is seen in children before puberty. This type of Kaposi sarcoma usually affects the lymph nodes and other organs and can progress quickly. Iatrogenic Kaposi sarcoma or transplant-related Kaposi sarcoma. When Kaposi sarcoma develops in patients whose immune systems have been damaged after an organ transplant, it is known as iatrogenic Kaposi sarcoma or transplanted-related Kaposi sarcoma. Most transplant patients should take drugs to keep their immune system from rejecting the new organ, but by weakening the immune system of the body, these drugs increase the chance that patients infected with the herpes virus will develop Kaposi sarcoma. Discontinuing such immunosuppressive drugs or lowering the dose often makes Kaposi sarcoma lesions go away or get smaller.
Now look at extract 2. Questions 37 to 42.
The samples of tissue cells can be taken from almost any part of the body, depending on the type of tumor and its location. The method of taking samples is determined. For instance, the methods followed for brain biopsies is entirely different for skin biopsies. Certain types of biopsies involve the removal of an entire organ, which are only performed by surgeons. However, other types of biopsies remove tumor samples using a thin needle or through an endoscope. In this session, I'm going to explain the most common types of biopsies used in cancer diagnosis. Needle biopsy. Fine needle biopsy or fine needle aspiration and core needle biopsy or core aspiration are the two types of needle biopsies. Fine needle aspiration is performed using a thin, hollow needle affixed to a syringe to pull out small pieces of tissue and a small amount of fluid from the tumor. In case the tumor is deep inside the body and cannot be felt, then the needle can be guided while watching on an imaging tool such as an ultrasound or CT scan. The main advantages of fine needle aspiration are that there is no need to cut the skin, and in some cases, the diagnosis is made on the same day. However, the disadvantage is that sometimes it becomes impossible to remove enough tissue for a detailed diagnosis. Although fine needle aspiration is a type of biopsy, it is also classified as a cytology test. However, in a core biopsy, the needles are slightly larger than those used in fine needle aspiration. In a core biopsy, a small cylinder of tissue is removed. At times, special vacuum tools are used to get larger core biopsies from breast tissue. However, diagnosing core biopsy samples take longer than fine needle aspiration biopsies. Therefore, the results also take longer. Excisional or incisional biopsy. In this type of biopsy, the surgeon cuts through the skin to remove the complete tumor, called an excisional biopsy, or a part of a large tumor called an incisional biopsy. In an endoscopic biopsy is a flexible, thin, lighted tube with a lens or a video camera affixed at the end, allowing the physician to look into the internal parts of the body. Tissue samples are also taken out through the endoscopic biopsy. Different types of endoscopes are used to look at specific parts of the body. For instance, one kind of endoscopy is used to look at the inside of the throat, sinuses, and nose. Laparoscopic, thoracoscopic, and mediastinoscopy. Although laparoscopy is much like endoscopy, it uses a laparoscope to look inside the abdomen and remove tissue samples. Similar procedures are followed to look inside the chest. These are called thoracoscopy and mediastinoscopy. Laparotomy and thoracotomy. Laparotomy is a kind of surgery where a vertical cut is made from upper to lower abdomen to remove samples. This may be performed when the suspected area could not be diagnosed with other simpler tests. There are many ways to perform a biopsy. The skin based on the type of suspected skin tumor. Shave biopsies remove the outer layers of the skin for certain basal cell or squamous cell skin cancers. However, they aren't used for the suspected melanomas of the skin. As discussed earlier, punch biopsies or excisional biopsies are used to remove deeper skin layers and are diagnosed how deeply a melanoma has gone into the skin. Sentinel lymph node mapping and biopsy helps the surgeon to know which lymph nodes to remove for biopsy. Sentinel node mapping and biopsy is a common way to diagnose whether a cancer such as melanoma or breast cancer has spread to the lymph nodes. This can detect the lymph nodes that drain lymph fluid from where the cancer originated. If the cancer has metastasized, these lymph nodes are usually the primary parts to affect.